And we are back with our Health First segment with Lima Memorial Hospital OBGYN Dr. Rhonda Medina. And first of all, this is Cervical Cancer Awareness Month. So why don't you start, doctor, by telling us a little bit about who might be at risk for cervical cancer?
Okay, well, so cervical cancer is actually a non-hereditary cancer that affects just about anyone. Basically, usually between ages 35 and 45 is when it's detected, but it can affect anyone from 20 to 65 and even further.
For our women who are out there watching, what are some of the symptoms that they should probably most likely be looking for and aware of?
So the thing with cervical cancer is that there's very few symptoms until it's actually advanced. It's a slow-growing cancer, so it's best to be detected early. But if it isn't detected, or if you do have it, the most common symptom is like a vaginal discharge or abnormal bleeding after intercourse. If it's advanced, then you get leg swelling, fatigue, weight loss, but that's if it's advanced cancer.
Doctor, is there anything that women can do prior to being diagnosed with cervical cancer to kind of help keep this at bay and make sure that they're as healthy as can be?
So the good thing about cervical cancer is that it is slow growing, and it is something that can be detected early when it's in the precancerous stages. And that's the importance of having pap smears. And there's a newer test called the HPV test, which is a human testing for high-risk human papilloma viruses.
Okay. Well,
the most important thing is to have annual exams and to be tested for cervical cancer through your pap smears.
can you kind of quickly walk us through what that pap smear process might be like for women who have never done that before?
So a pap smear is a speculum exam that's done in the office, and we just sweep some cells off of your cervix, and those are tested. If you have an abnormal pap smear, it is just a screening test, so it does not mean you have cervical cancer. It means that we have to do further testing, which is usually a colposcopy or a biopsy that's done in the office, and that'll help us determine whether or not you have precancerous changes or cancer.
Could you tell us how a woman might be able to get in touch with you if they're interested in having something done to take a look and see if they're at risk right now?
So they should call the office of any OBGYN. Ours is always accepting new patients. The important thing is to have your annual exam. There are some people that think that they don't need to be tested anymore because of their age or their risk factors. There's also other things that we talk about, and we can help determine whether or not you're eligible for. There's vaccines against HPV, and just a regular pelvic exam is what they need to do.
All right. Well, Dr. Rhonda Medina, thank you so much for joining us this afternoon. And we hope that women will take advantage of the fact that this is Cervical Cancer Awareness Month and make sure that they are getting a clean bill of health. We thank you for your time today. And we'll be right back with more after this.